Hello, everybody. This is Attica Lundy Cooper back, and I am doing a talk with you guys today about a nerve condition called trigeminal neuralgia. Okay, so trigeminal neuralgia. It's a nerve condition, and it is very, very, very painful, guys. It causes a lot of facial pain, and it can actually mimic a toothache, or and not just any old toothache, like a really bad toothache, guys. So in 2018, um, I was going through a stressful period of time, and it wasn't anything abnormally stressful, but it was stressful. And like just talking about it, it's starting to happen now. um my jaw started hurting, right? So I'm thinking, uh it's a tooth pain, because at first it was my jaw. So I was like, am I getting like a stiff jaw? And then it was more like a toothache. So I said, I need to go to the dentist to check this out, because it wouldn't go away. Um, for 2 days, I'm sorry, I was looking at my dog. For 2 days, I experienced the pain that was coming, like by my mouth. And maybe about the third day, it got worse. So I was taking BC powder, right? Because the BC powder seemed to make it go away. But it's never a good idea to take too many BC powder. So I'm going to look on a box, and the directions on the BC powder is place one powder on tongue every 6 hours while symptoms persist. Drink a full glass of water each dose and stir the powder, or stir the powder into the glass of water or other liquid. Okay, so you're only supposed to have this every 6 hours. People, I was having to take it more than every 6 hours because it was excruciating. That's how bad it became. It became excruciating. Now, that's a really important word, so don't forget that word. So, this was a Friday, Saturday. By Sunday, it was excruciating. And I looked up excruciating face pain, excruciating mouth pain, and then I tied them together and put excruciating um, face and mouth pain with multiple sclerosis. That was the trigger word, excruciating, and it immediately pulled up this nerve condition that I had never heard of it. Um, and so it was trigeminal neuralgia. Um, I read about it, and I was like, wow, okay, so it's common in MS patients, MS standing for multiple sclerosis patients, and I had no idea about it. I was diagnosed with multiple sclerosis, with relapse and remission multiple sclerosis, or RRMS, in 2004. So this was 2018, and this was clearly years after my diagnosis, that I would come down with a condition known as trigeminal neuralgia. With multiple sclerosis, many patients with multiple sclerosis know that you have to also become your own doctor. And thankfully for the internet, there is um, opportunities to find out, some symptoms. It's never a good idea to just go in and just like try to become your own doctor completely. But with the assistance of the internet, we are able to look up a lot of stuff. So I saw right away what that was, and I called my neurology nurse office and left a message. Hi, this is Attica Lundy Cooper, and my date of birth, blah blah blah, social, blah blah blah. I am experiencing trigeminal neuralgia, and it is very painful, and I have been taking BC powders along with my regular medications. So please help me. And then I cried, not because I was sad about the trigeminal neuralgia. I cried because it was hurting so bad. If you can imagine someone putting a crane type object in your jaw and expanding it, almost breaking your jaw, and your teeth um, being pulled out of its socket at the same time. I'm talking about extremely painful, and it's typically in the face, and it's typically one side. So they, the next morning, my nurse called promptly at 8 o'clock, 8:05, 8 o'clock, 8:05, something like that, a.m. And she said, I ordered your medication. Go pick it up at the pharmacy, and it's carbamazepine. I was like, Carba, who? But I was in pain. I was like, whatever. Okay. So I get to the pharmacy and I get this pill. I'm gonna see how do people do it. So a little white pill. I took the little white pill, and within 20 minutes, the pain was gone. And I was like, thank you. So there is a treatment. There's several treatments. Well, not several, but it's a few treatments. It's like two different pills you can take. I got the carbamazepine, and I think Lyrica might be the other one. But definitely some home remedies that I've used were ice pack and heat pad alternatively, like consecutively. Um, Also, yeah, so I did the carbamazepine. Well, that was 2018, and it probably lasted a month. Because with RRMS, you have things that happen, and then it runs its course, and then it's gone, and you're normal, right? So about a month of taking carbamazepine twice a day, um, I was able to overcome trigeminal neuralgia. Fast forward 2019, and last week it came back. I have been under a lot of stress, and what I found is that with trigeminal neuralgia, it's very rare. It's it is so painful that you do contemplate suicide. So it's a very dangerous condition because of that. It's maybe about a handful of conditions that are known as suicide conditions where the pain is so extreme and so excruciating, you would feel that death would be a better solution, an end to the pain. Don't do that. Do not commit suicide. Just know that there is treatment. It might not seem at the time because it's excruciating pain in your face. And there is a trigeminal nerve. I don't know exactly where it is around here, but it's somewhere around here. Now, one of the solutions that they have is surgery, where they would go in and I guess they would sever the trigeminal nerve so that it doesn't trigger. I'm not going to do that because at least 11 months out of the year, I'm fine so far. But what I have found is that this time around, any hint of stress, not even me talking to somebody. I thought if it was me talking to somebody and they stressed me out, that's when the pain would come more often than the two, because I take medicine twice a day for it. But sometimes in an interim, in the middle of the day, you have stresses. So I thought that it was like if I talked to people, so I kind of stayed to myself. No, it has nothing to do with even talking to people. You can think things and then the stress will start coming. So this is what the second of the month is things that I think about. Let me give you some examples. Rent and mortgage, rent time. Uh, because there's a situation going on right now that is financially like being in a financial hardship. I won't say a hardship. I will say a hardship just because I just want to show it that it's stress. It's stress at the same time. I have other things going on. As soon as I start thinking about any of those things, whether it's stress or family or the trigeminal neuralgia or um, just anything stressful that I might think of, my business, just any of my business that is slightly even stressful, boom, it attacks. So, like, we know how people say your body is attacking itself. That's what's happening. And it is so painful. If anybody knew exactly how painful it was, they wouldn't even, you know, talk to me unless I came to them. They would pretty much leave me be just because I can't risk anything being stressful. So I am on sort of like bed rest right now. I can get up and do things, but I have to stay away from stress or I'm going to be in excruciating pain. And I know yesterday people were calling me and I was like, hello. And they were like, oh, I'm sorry. I woke you up. And I'm like, no, I'm hurting. I was hurting so bad. You probably couldn't understand me on the phone, but it's very painful. So this time around with the trigeminal neuralgia, this is a better time, not with lack of pain or anything like that. It's starting to hurt right there. And it normally hurts around here, but I'm always afraid when you have face pain, especially on the side, nerves and stuff, I get extremely paranoid. I'm like, oh no, what if it's going to be an aneurysm or something? Because I'm not inside looking. And but yeah, this time around, they ordered me a big old 90. How many is it? 180 pills. And I do remember last time they did tell me, don't eat so much of this. Don't take so much of the BC powder. Just if you have to go up, take a third one on that day instead of just the two. So I've arranged it where I will take one in the middle of the day also, in addition to what I'm already taking. But I'm just going to read some stuff off to you about trigeminal neuralgia at this point. That was my experience with it. Um, I'm kind of like, okay, why are you giving me 190 pills? So I'm thinking maybe this one might last a little longer. Um, or maybe they just want me to have some on hand. I don't know. But the last thing I'll say about, well, I don't know if this is going to be the last thing I'm going to say, but about mine. But the last thing that I would like to say about mine until I start getting into the actual reading, what I found on the internet, is that this is a 50 pack. Within the last week, I have had to take so many because of day-to-day stress. It hits me. If I start talking to somebody or thinking about something stressful, it hits me. So I've been trying to just zen out, like zone out, watch funny videos. But it can also be triggered when you brush your teeth or eat something cold or whatever. Like, it's ridiculous. But look, out of a 50 pack, I only have this left. And this video has been on for 15 minutes, and I took one right before we got on because I was thinking about something and it started making it hurt. You can't help but to think about things, though. Your mind is going. So if your mind is going and you're thinking, you know, if it's stressful topics, then you could have excruciating pain. So yeah, this is all I have left of the BC powder. Um, but I will be taking the carbamazepine 3 times a day instead of twice a day, and um, probably turning my ringer off and just screening my calls and doing some chanting and some meditation and just trying not to think about anything stressful because obviously it's gonna kick my butt. And that's the thing, people can bring stress to you, but they don't feel your pain. They don't understand that just them talking to you, if it's a stressful topic and you get stressed out or you have stressful thoughts, they're not feeling your pain. They don't get it. They might bring it to you because they need you. You can't talk to them during this time because at least with me, it gets triggered by stress. So I don't know what brought it on again for 2019, but I do know what's affecting it is stress. So I have to stay away from stress. Okay. So trigeminal neuralgia and MS, and understand people that don't have MS also get trigeminal neuralgia, but it's very common with MS patients. Um, Rare symptoms of multiple sclerosis. What is trigeminal neuralgia? Trigeminal neuralgia, or TN, is a painful condition in which this nerve becomes irritated. Symptoms of TN range from a constant ache to a sudden intense stabbing pain in the jaw or face. Um, and typically it's an early MS symptom. But like I said, I got diagnosed in 2004 and I first experienced it in 2018. Um, so that's one of the things. It's often treated with carbamazepine to begin with. Baclofen may be given to help relax the muscles. If medication doesn't work, surgery may be required to deliberately injure the trigeminal nerve so that it stops sending pain signals to the brain. And that's the thing. Your brain handles everything. So the thoughts that you have control your body, right? And control what you're going to say, all that. So most definitely by thinking, it triggers something, and it's triggering the irritation. It triggers the trigeminal nerve to get irritated. It's excruciating. Just imagine a nerve, somebody just, so when somebody brings some stress to you, it's like they're picking at that trigeminal nerve, and it has caused some people to kill themselves. And so I just want to make this awareness, bring awareness as always. Um, Trigeminal neuralgia is an initial symptom of an MS, possibly a relapse. So I might be going through a relapse right now, and I will be contacting my neurologist to let them know that I'm still experiencing it, and that I need to come back in because I might be having a relapse. Um, and it can be confused with dental pain, but this pain is neuropathic in origin, so it's caused by damage to the trigeminal nerve. Has nothing to do with your teeth. Well, I won't say it has nothing to do with your teeth, but I will say that I'll be going to the dentist just as a follow up. But I also have to go to the neurologist to let them know because something's going on in my brain that's um, triggering this trigeminal nerve. Therefore, because it's been over 3 days of happening, it is trigeminal neuralgia. It can also cause migraines. So I have had headaches. They have been migraines, but they haven't been extremely bad migraines. Um, yeah. So that's pretty much it. You can have trigeminal neck pain also, and I did not know that. Um, so they are doing studies to see. Um, they are doing studies to see how stress does, you know, affect it and what other factors affect it. But it's definitely being injured right now. So let's see. 7 triggers is kissing and touching, which I have not done. Tilting your head, stress and tiredness, which is definitely weather, heat, cold, rain, wind. We have had snows. Oh, the sun is so pretty out right now. Eating, chewing, swallowing, talking, smiling, laughing, hair brushing, and teeth cleaning. All of these things are triggers of TN, trigeminal neuralgia. So I don't know if I told you anything that you can't read, but this has been my experience. It is a condition affecting the largest nerve in the face that provides sensation. Symptoms include electric shock like sensation, burning, aching, searing, hammering, pain in the teeth, cheek, jaw, eye, and forehead area. Described by the medical field as the worst known as the worst pain known to mankind, has been nicknamed the suicide disease. So I'm in a lot of pain, guys. This is the picture, and I'll, I'm in an extreme amount of pain. So if you know anybody that is suffering from trigeminal neuralgia, I'll ask that you kind of give them a time out on issues so that they can heal. Um, Definitely understand that if they are angry or short tempered, it's because the pain is excruciating and it is known as the suicide disease. But I'm not going to commit suicide. I'm going to endure it. It's actually more painful than natural childbirth, if you can imagine that. But I tackled that, and I'm going to tackle this. Thank you for your time, and be sure to subscribe and push your notification bells because I will be um, doing more videos of awareness for MS and other health concerns, as well as a lot of good tips. So, see you guys later. Thanks for your time.